Ovarian cancer treatment is intense. And one question comes up again and again. What else can I do to support my body? Let's be clear, no alternative therapy has been proven to cure ovarian cancer. But the right complementary care can make treatment more tolerable and recovery more supported. Ovarian cancer is often diagnosed late. Treatment usually involves surgery and multiple rounds of chemotherapy. It's effective, but physically and emotionally demanding. Standard chemotherapy, carboplatin and paclitaxel, can cause fatigue, nausea, nerve pain, and immune suppression. It works, but it takes a real toll on the body. So patients start searching natural treatments, herbal remedies, holistic care. Not to replace treatment, but to feel better, recover better, and regain some control. Some approaches do have real clinical evidence. Acupuncture can reduce nausea, nutrition support improves treatment tolerance. Mind-body therapies improve sleep and anxiety. But not everything natural is safe. Some therapies are based only on lab research, not real patient outcomes. And some can interfere with chemotherapy. For example, curcumin shows promise in lab studies, but lacks strong clinical evidence. Mistletoe therapy may improve quality of life, but needs medical supervision. The biggest risk? Using alternative treatments instead of medical care, or delaying treatment while trying them first. This leads to significantly worse outcomes, especially in ovarian cancer. The most effective support often comes from simple, consistent habits, good nutrition, gentle movement, quality sleep, and stress regulation. Simple, but clinically meaningful. At Thrive Integrative Cancer Care, we guide you through these lifestyle changes with a personalized approach. Scan the QR code to book your strategy call and take the first step toward a more supported cancer journey.